those families that are just starting this journey, what is that co-occurring, or people may even hear comorbidity. Uh, what does that mean? What does that look like when we're starting talking about dyslexia and maybe ADHD or something like that? What does that mean to these families that are just now starting this journey of my child's just been diagnosed with dyslexia?
Well, the question that they're really going to be trying figuring out is this going to take a lot of work to help remediate? Part of that's related to how severe the difficulty is and how many other diagnoses the child has or we think there's going to have. And part of it relates to what program are you going to try and use to actually help improve the skills. In healthcare, we're guided by scientific studies of treatments. And so you're looking at what research tells me what's the best treatment for condition A or disorder B or diagnosis C. In education, that's not the driving factor for how you make choices. And a good example is we have one word that's used in both professions, and that word is evidence-based. In healthcare, Dr. Shaywitz, being a pediatrician that most all families with dyslexia have heard about, Overcoming Dyslexia, her book, the science that she reviews, the Yale Center for Dyslexia and Creativity. And she very clearly states that you should be using the definition of evidence-based that comes from the healthcare sector, which means randomized controlled trials are going to be our best scientific evidence that a program is effective. In education, the word evidence-based doesn't mean just randomized controlled trials. It can also mean has a group of people seen progress with a program, and if a large enough group of people think a program works, then they're allowed to call it evidence-based. So these are two very different definitions of the same word. So families need to help understand who they're talking to, and they might be using the same terminology, but they actually might have different definitions of it.